The number of confirmed COVID-19 cases worldwide reached 12.6 million on the 12th of July, and South Africa has seen record numbers daily since the move to level 3. The World Health Organization warned that the threat of COVID-19 would put immense pressure on the healthcare system with ever-increasing numbers. South Africa saw an increase of nearly 65,000 cases in 1 week. Gauteng is currently considered as the hotspot for coronavirus cases, with close to 82,000 reported by the 12th of July. Gauteng Premier David Makhura, who is currently self-isolating after testing positive for the virus, addressed the public at the end of May, outlining the key pillars to help the province deal with a volatile economy while also ensuring the health of its citizens.
So we do watch this area very, very closely. The number of active cases, it means these are the people who require attention of our health interventions. They require attention. We need to know where they are, that they are in quarantine or in self-quarantine, and including those who need medical attention, that our clinicians are they are paying attention to them. So they are essentially under surveillance as well. Who amongst them need hospitalization? Because some of them and most of them would always just have mild symptoms, but those who need hospitalization, but also as you focusing on the active cases, you want to make sure that they are not interacting with the general public or family members and therefore infecting more people. So it's always important for us to focus on how many active cases and have all kinds of measures around those active cases that we know on a day-to-day basis. Our health professionals, the senior management team that's guided by Dr. Masuku pays very close attention to those.
The provincial government supports the overall health protocols of washing hands and wearing face masks, but a large number of people, especially in townships, don't have access to running water. So what is the provincial government doing to help combat the spread of this virus?
Contact tracing is very, very important, because if you have positive cases that we are watching very closely, and we have traced all the contacts. It's not enough just to know these contacts. We geomap them. We also map where they are located. But it is also important to find all of them. So contact tracing in Gauteng, this is from the National Department of Health. You'd see that this slide was shared with the citizens of our country by the minister. We are at 98% of contact tracing. We want to get to 100% of contact tracing, basically account for everybody, so every time there is a report, every day when there is a report, every time there is a report on the number of new cases, the first issue of interest to us is where are they, who have they interacted with, under what conditions are they now? Are they in self-isolation or not? Or they need to be put in our facilities, quarantine facilities. But also tracing, once we trace the positive cases, tracing all the contacts, particularly now that the pandemic is going into our townships, we have been putting those contacts that are in the townships where it's difficult to self-isolate and self-quarantine. We are also putting them, they need to spend 14 days in our quarantine facility. So that's what we are doing.
A shortfall of testing capacity is undermining South Africa's response in the fight against the pandemic. The World Health Organization warned that a shortage of testing kits will be a challenge for the country and the continent. The Gauteng MEC for Health, Dr. Bandile Masuku, laid out a new strategy to help with targeted care and the screening process.
we are calling the ward-based COVID response plan, which deals with the hotspots. Because the hotspots, as the Premier has indicated, these are areas that have got high number of individuals who are infected and high number of individuals who are contacts. And now, because we require more of the community involvement, we require more of the society to be the one that enforces the regulations, particularly at ward-based level. We are working with the Department of COCTA, Cooperative Governance and Traditional Affairs, to make sure that these teams are actually improved and they are put into place, and they are also multidisciplinary and actually sectoral. These teams will also include civil society, it will include FBOs, faith-based organizations, it will include NGOs, it will also be linked to a EMS base, it will also involve our community health care workers and EPWP people that we have employed who will be working throughout, and also our public health experts in our clinics. And it also will involve GPs and family physicians around the area. So these are teams that are going to have the data, that will be able to know that where the individuals are, and also help us to mobilize society to be able to enforce, the regulations. And also part of the intervention will include issues of social security, in terms of food security and others, and also address other public health issues which we are all concerned about, and also improve education about COVID, also look at people who have to be compliant with HIV and TB treatment, and also look at other chronic conditions. Averagely, we do over 5,000 tests per day, and we are working very hard. We have already enlisted a private-owned laboratory company, which is helping us to improve the turnaround time of the testing. And I think the important aspect about the testing is just for us to be able to have limited and less disruption of actually services. And we are also working on with the private sector, like I've said before, that there will be available testing machines that have been given to us for us to be able to utilize actually moving forward. Our focus point, particularly for the turnaround time of the tests, it will be our healthcare workers particularly, and then when we deal with areas of hotspots and many outbreaks, it's when we're going to utilize our private labs and even our own machines of actually testing. And I think this is how we can be able to deal with it. And we also made a call with the private companies, with the private sector, to actually continue with their screening and testing programs, particularly in the areas that the Premier had actually spoken about, that we have identified as high risk, your mining sector, your factories, industry, construction, and also the retail sector. We are continuing with the screening and testing in those areas.
MEC Masuku further announced a response strategy to be followed by the districts. Response teams were formed with the purpose of dealing with the shortage of personal protection equipment, providing support management, as well as to the COVID-19 steering committee, amongst many other duties.
So the response team, as established, will actually make sure that it supports the management, it supports the steering committee, to ensure that we are able to resume the services of the facility at a stipulated time after decontamination. At least this should happen within a rapid time, and at this time we are talking about an hour after the case has been actually reported. The team also will be able to activate tracing, contact tracing of the individuals that have been exposed to the infected healthcare worker. And this also, when we say tracing team, it also includes activating the laboratory services. This is one area that we have actually able to improve, because the turnaround time of the results actually rely on the laboratory services. And we have been able to enlist private laboratory service companies that help us to make sure that the response time is quite quick and we're able to get the results as quickly as possible.
Furthering support to and from the national government to ease the pressure on the health system, Dr. Masuka supported the call on the ban of alcohol sales, stating that it was a cause for concern, as the results of the sale of alcohol added pressure to the already strained health system. On Sunday, the 12th of July, President Cyril Ramaphosa announced an immediate prohibition on the sale of alcohol.
As we head towards the peak of infections, it is vital that we do not burden our clinics and hospitals with alcohol-related injuries that could have been avoided. This is a fight to save every life, and we at the same time need to save every bed in our health facilities. We have therefore decided that in order to conserve hospital capacity, in order to make sure that there are sufficient and enough beds in our hospitals that are not taken by those who come in resulting from alcohol-induced trauma or injuries. We've now decided that the sale, the dispensing, and the distribution of alcohol will be suspended with immediate effect. There is now clear evidence that the resumption of alcohol sales has resulted in substantial pressure being put on hospitals, including trauma and ICU units, due to motor vehicle accidents, violence, as well as related trauma that are alcohol-induced.
All these measures were put in place to help secure the safety and health of the people of Gauteng and the nation.
And we always say to you, so far, so good, but the road ahead will be tough. The road ahead will be tough. And we don't want to give the people of our province false hope. We always say we need to do all these things. So far, we have been able to do well under the lockdown conditions, and the lockdown has worked for us in Gauteng. Evidence is there to point out that the lockdown has worked, but the road ahead is something that we must chart together.